All right, well, we might get started as a few more people might join. But good morning, everyone. Thank you so much for joining us this morning for this information session about upcoming opportunities to participate in PacMOSSI operational research
Oh,
projects. So, some of you might be aware of the projects we've done in the past. We've done some studies looking at, what's the most practical and effective mosquito trap. And we've done a lot of individual projects in different countries, looking at everything from GIS approaches to community engagement approaches. And I guess the whole purpose really is to answer operational questions you may have or fill information gaps in your vector control programs. So understanding, how well the program's working or how it could be improved, things like that. So for the next round of operational research, we have a couple of different ideas in mind, which we have developed based on feedback from you all over various meetings and over the years in many discussions. Today, we're going to discuss one of the two topics we have in mind for operational research. If that's a topic that doesn't interest you in your program, it will still be relevant to listen because we'll use the same kind of format and structure for the next topic, which will be announced in the coming weeks. So the other thing I wanted to say is that our core partners in PacMOSSI, the University of Queensland, are really leading the coordination of this work. So that's Adam Craig, who many of you will know, and Sebastian, who's also online. You'll hear from him later. And we like to involve other of our core partners as well in designing the projects. For the project we're going to discuss today, our lead sort of partner in coordinating and designing that project are our friends at PNG IMR. So Melanie from PNG IMR is on the call today, who'll also be talking with you. And then for future OR, it might be different partners. But I mention that just because I would like to encourage all of you during this call to think also about whether you have any local partners that you think might help you in conducting this research, because we recognise conducting research, even if it's operational research that's relevant to your programs, it's not something that a lot of programs have time to do. So it might be a good opportunity to consider through this call whether you have any local universities or NGOs or other partners that might actually help you to answer the questions you might have. But I won't talk too much more. I just wanted to give that sort of bit of an overview. I'm going to hand over to our colleagues from UQ to give you a bit more information about the next operational research topic that we would like to seek your interest in. And then there'll be a bit of time at the end for you to ask questions and we can discuss a little bit what people think about it. So with that, I'll hand over to Adam and Sebastian to tell you a little bit more. Thanks, guys.
thank you, Amanda. So I think I'm going to share here my screen. If you confirm that you are seeing my presentation just right now.
It's loading. Yes, we see.
Yeah,
Looks
you can see.
great. Yes, wonderful.
Okay, perfect. So good morning, everyone. Thank you for joining us today. So I don't know if most of the people know me. My name is Sebastian. I recently joined the PacMOSSI team this year. So thank you very much for the introduction, Amanda. And as Amanda mentioned, we're going to present now on a potential idea that we have that is led by PNG IMR. So Melanie is here with us. So if you have any further question about the protocol of what we are going to propose, we're going to have support here as well. So my idea is to show you in this presentation an orientation of what we are planning to do. It's not a fixed protocol, so it's something that we want to discuss with you, to co-design with you, to understand how it's going to be the best approach to implement this idea. So I'm going to present a high-level overview of what we are planning to do, the benefits, and how you can proceed to this interesting and applicate to participate in this operational research. So let me check. Oh, I changed the slide, right? You can see the next slide. Yep.
Yes,
Good,
we can.
perfect. So to have a success vector control, of course, you have many factors that influence in the efficiency of any vector control. But one of the key pillars to have in place is the community participation. So we need to understand how the community can participate better, to understand the instructions, to follow the instructions. And we have some limited information, limited evidence about the knowledge, the attitudes, and concern about all the mosquito management practice that we have in place. So larviciding, spreading, station eliminators. So the question of this research is based in how the communities understand and experience this measure, and how we can improve the implementation that we have to put it in place. So we want to understand how the community have knowledge, attitudes, and practice, often that we call CAP, as well to understand the concerns, the preference, the barriers, and the overall acceptability that they have in the communities. So this is essential, again, to create trust, to understand how we can face the barriers that they have. So the idea of this project is to find these enable factors and to identify these barriers.
Yes.
Okay. Yeah. Charlie? Okay. Oh, good. So the idea of this proposal is that this finding will understand better how the mosquito management approach are put in place, and of course to understand how is going to be the communication with the communities, how we can improve the engagement of the communities, and of course how to improve the planning to put in place all this strategy that each country have different between spraying, special eliminators,
Charlie, would you mind muting your microphone, please? Thank you. Yes, if you wouldn't mind just hitting the mute button. Thanks a lot. Go ahead, Sebastian.
Thank you, Charlie.
Volume.
So as mentioned before, the idea of this, of how we're gonna collect this information from the communities, is not something that is fixed. It's something that we want to discuss with you about how is gonna be the best approach to do it. So we have some possible data collection approaches. So I put it here in this slide for how we can collect this information. So for example, we can use some household surveys, so create a questionnaire to understand the knowledge, the practice that they have in place, how is the acceptability. But also we can work with focus groups, so we can go deeper in this understanding, to have a more open questions, to create this discussion within the group. So that's another approach we can use. And also we can use key informant interviews. So we can work with local leaders, we can go with governmental persons. So we have different approaches. And of course, that will depend of what you can do in your place, what work better in your place. So again, this is just a possible data collection approaches, but the idea is to understand what is going to be better for you. So that's the idea of the co-design of this protocol. So which one will be the benefit of the participation? Of course, if we have a better understanding of how the community understand how the fears, how are the barriers that they have in each community, we're gonna understand the perceptions of the vector control methods. So that is really important to be the measure more effective. Also, if we have any concern, specific concern in the communities, we can work better with the risk communication, with the community engagement strategy. So it's something that we can put in place differently and most customized for each country. Of course, if we can see some point of improvement, we can work better on it so we can strengthen implementation planning. And of course, if we have all this in place, the mosquito control measures, if we have the community participation actively follow the instruction, of course, we can better understand how the mosquito management approach work in each country. So what the expectation of the participating countries is co-design, is support the ethic application that we need to have in place to develop this operational research. And of course, we're gonna need a local team that support all the activities that we are planning. Again, we're gonna open now for discussion on how we can create this research or local partners, if you have any collaboration going with the government and trying to create this co-design, and if this is possible for you to put it in place. And of course, you're gonna have the support of the PacMOSSI and the PAGMR related to the planning and preparation. So we're gonna be with you giving the support of co-design, which one will be the best method to apply, to draft the protocols and the procedure to apply to the ethical and in each country, do the local trainings, and of course, giving you support during the implementation, the data collection, and the analysis and dissemination. So that's a high-level overview of what we are planning to do. Again, focuses more in this CAP and acceptability study for the communities to understand better the mosquito control approach that we have in place. So now I'm gonna open for question and discussion about the project. So the suitability for the countries, the feasibility of the countries to implement this idea, this operational research study. So I open to question to you.
Great, thank you, Sebastian. I might first invite Melanie from PNG-OMR to see if she wants to add any comments or speak about PNG's experience in this area. And then that'll give people time to think of their questions. Melanie, are you there?
Yes, good morning, everyone. And thanks for joining us today. Thank you, Sebastian. That was a good overview. And yes, so in PNG-IMR, we have a special team that do qualitative research. And yeah, we have them for the vector control products and all that with our NotNot project. And we have that team already. We've been notified and they're aware of it. And, you know, they said that they are happy to come to the countries and provide training and support with everything. So that's what, you know, we have a strong team here to help each country to carry out the research. And we have that team as well, and also the support with protocol development. We have that as well, so we can provide all the support that you need. Thank you.
Great, thanks, Melanie. I know PNG-IMR has great prior experience running these sort of, you know, these projects to look at what the community attitudes are for malaria, at least. So I'm sure your team will bring a lot of experience to the study design. I might ask if anyone on the call has any initial questions based on Sebastian's presentation. We haven't gone into a lot of detail about the methods and the design because, as Sebastian said, we actually want to first find out who would be interested in participating in this work, and then we actually want to design it with you. We don't want to prescribe, go and do this. We want to ask, say, for example, in Fiji, what would make the most sense if we wanted to reach out to communities and ask their opinion about vector control? What would make the most sense in terms of the way to do that? And that could be different to what we might do, say, in the Cook Islands or in Tonga or in French Polynesia or any of these other countries. So our plan today is to just talk about what it's all about, let you ask some questions about what does this all mean, And then we will get you to let us know if you're interested, and then we'll do some additional calls where we will actually ask your opinion on how could we do this in your country. Does it make sense? And does anyone want to ask anything initially? Feel free just to unmute and yell out, or if you want to write something in the chat, if you prefer to just, yes, I see. Is that you, Jacob?
Yes, Amanda. I'd like to just ask or get some clarification from the presenters on this important area of operational research that have come out. So, yeah, allow me to thank Sebastian and Adam and Melanie team that proposing this area of information gathering. Yes, vector control is still our key pillar in the fight against malaria. And, a lot has been done already in terms of research and information gathering, but still, there's still a lot more to do. I'm beginning to realize that, as I say, longer in the program. And so I want to thank you for, rekindling the interest again and coming up with the ideas or areas on how and where we should get information to support us in this fight. The fight against malaria is a tripartite type of fight. It's a tripartite, three-party war we are having. Fight against the parasite itself, and then the vector, and of course us human beings too. It's a fight against among ourselves. So there's a lot more to learn from these three organisms getting together to cause the disease called malaria, right? So the vector control, as I'm seeing, has to really start from the start. That is the larvicide, the egg. Start managing. Let's look at how best we can manage the early stage of the larva, the vector development. It starts from the laying of an egg and the development of a mosquito from that egg, and then that mosquito, when it becomes an adult, becomes the problem. So I would be happy, like some KAP assessments or some research like this done on in the area of larva cells management. I've been fascinated by some new developments like the drones and the AI that is being installed into the drones and used to spot stagnant waters and pools that are containing these larvicides, and that's so. If our research could target the community and their knowledge about this larvae, and then we can later use those findings to develop interventions on how we can manage the larvae sources, and then put what sort of larva sites we can put into those larva sources. So Sebastian and Adam, you can clarify more about the focus of the operational research that you are thinking. I heard you said we're going to start from the start, which is managing the larvas, destroying larvicides and stuff like that, and then on to managing adult mosquitoes. So where would your focus be at? And PNG, we've started Another person asking question, or it's me asking the question?
You go, Jacob.
All right, okay. Sorry. So we discussed about introducing, the drone technology for lava site management, assisting us to pinpoint where the stagnant pools are and where the lavas are and all that. But our issue is really about community acceptability, whether they know what we are trying to do, whether they understand that, or so that KAP gap is quite widespread in our communities here because of illiteracy, accessibility, and stuff like this. So please,
Sure.
I've said enough. Can you continue clarify some of my confusion?
Sure. Do you want me to jump in, Sebastian, or do you want to respond?
Please go ahead.
Yeah, sure. Jacob, thank you. I think your experience from Papua New Guinea and with all the malaria work that's gone on for so many years is invaluable. Your comment and your analogy about the tripartite needing to address different aspects of the transmission pathway to control malaria is the same for the countries that don't have malaria, obviously dengue. This project or this proposal came out, as Amanda said, from lots of talk, and it was really looking at that human element in your tripartite approach. So you talk about the mozzie, you talk about the parasite, but the humans are the people that need to accept or reject strategies like larviciding or like indoor residual spraying. So that human element is something that we've heard that countries have had troubles with, particularly as the recommendations and people move towards strategies like indoor residual spraying, which obviously take a lot more time and are perhaps a little bit more controversial. Charlie, I'm going to reflect on Cook Islands here. And I know that you've just done a big fogging campaign or big response campaign to your dengue outbreak, and my understanding was that there was quite a lot of resistance from the community, which wasn't perhaps as fully understood as could be. So the idea of this particular project, and it's totally open for discussion, was to really look at how the public, who are the recipients and the partners in any intervention, understand their risk and understand their concerns about things like indoor residual spraying or larviciding, to then obviously formulate better strategies in response. In a really practical terms, Jacob, I mean, this can be worked up as a group, but we were imagining this would look something like a household survey. There would be we'd get a sample size, so say 30 households in a village or 30 households in one or two villages. Collectively, this group, whoever signs up, would design the survey tool, and then in each of the participating countries, a team, whether that be a team of Ministry of Health staff or perhaps Ministry of Health staff with their community partners like Red Cross or somebody else, would go out and knock on the doors of those houses and implement this survey, this CAP survey, and collect data that way. And if we can get a number of countries involved, so 3 or 4 countries involved, we'll be able to get some sort of sense of what the sentiment of the public are towards these new chemical-based strategies to controlling mosquitoes. That's the thought. So we don't really need to go into the details of the survey, but it's really an open invitation to countries to be involved and to be involved in that co-design. And then PacMOSSI will support the rollout in the countries later this year or early next year. Does that answer your question, Jacob, or do you have any follow-up?
Oh, I think you clarified very well, especially on the tripartite. So, from a human perspective, we are looking, into our reactions and acceptability on the interventions and things that we can do to fight against the other two organisms. So thank you.
Yes, that's okay. I guess the important thing, Jacob, and you appreciate this, is that lots of people have been doing outdoors fogging for a long time, and that's accepted or not accepted. That's to be determined. But the new WHO guidelines are really encouraging people to move away from outdoor fogging into residual spraying, which comes with a whole nother set of challenges, both for communities and vector control programs. I mean, how do you go into someone's house and how do you communicate that and how do you get their buy-in so that they're not worried about the health and sort of inconvenience issues that are inherently going to come up through these new strategies.
Yes, interesting. The IRS is one of the recommended interventions by WHO, and the issue I think is really around the cost, one, and two is on what level of burden do you introduce the IRS? I think in a high burden setting or in a pre-elimination setting or that is something I think that should be considered. With PNG, our national strategic plan, we said to introduce IRS and then earlier on, this is the first year of implementing that strategic plan, and then we are getting people would say, "Oh, this is too expensive," and this is in a high burden setting. PNG is a very high burden setting, and I said if we introduce the IRS, what is the effect and outcome and return on investment and all of these type of things. So, thank you, Greg.
Sure. Okay. I think Charlie came offline to make a comment too. Hey, Charlie. You're on mute, mate.
Okay, can you hear me now? Hi,
Perfect.
kia orana, Amanda, kia orana, Adam, kia orana, Sebastian, kia orana, all our fellow colleagues on our Zoom this afternoon. This is 2 p.m. here in the Cook Islands on a Monday afternoon. Thank you very much for bringing the issue, Sebastian, about this OP survey. Of course, the Cook Island will be in a position to support and contribute to the survey, regardless of the programs and activities that is still earmarked and scheduled for the Cook Islands in terms of the Wolbachia program under the World Mosquito program, and also the PACSIT, sterile insect technology under the Maladi Institute in French Polynesia, and also Sebastian and Adam and Amanda, and the residue testing that will be done here in the Cook Island. I'm not sure what's the time under the PacMOSSI program, and of course, and the other program we are ongoing, Sebastian and Adam, is the PVS testing still ongoing with the Rarotonga. Now, I hope our team has completed Rarotonga last week, so we'll put through the final results of that. Those are the activities we are still embarking on and scheduled for the Cook Island. And with this one, of course, we would love to support it in terms of the response. What is our community's response to the intervention and prevention of our vector control activities here in the Cook Islands, not only here on Rarotonga, and of course, the rest of the Painu. The Painu is the rest of the islands in the Cook Islands. So that will be nice, and we will be looking forward whatever is required from your side and our side for this way to continue. And apart from that, we are looking forward also for the training in Papua New Guinea. So get ready, you three. You have to sponsor one extra participant from the Cook Island. We have earmarked 2 of these HPOs. We have with our Salah in Fiji. You have to pay for the extra HP. We want at least quite a few of our health protection officers to be involved in all the trainings provided not only by PacMOSSI and other relevant partners or sponsorship agents, etc., in terms of vector control here in the Cook Islands, and of course our contribution to our Pacific country for that matter.
Excellent. Thanks, Charlie.
Yeah, that's good.
I think, Charlie, with so many activities going on in the Cook Islands, it might be worth considering how this CAP survey, if Cook Islands is involved, can be integrated with something else that you're already doing to save your mental load, if not your workforce's labor. But we can talk about that down the track.
Okay, thanks.
I think I saw Ciala might have unmuted. Ciala or Lesieli, did you want to ask a question, or was that random?
I think it's
Okay.
good. We all heard from others, most of them. We appreciate what Sebastian short overview about the operational research. Is because we can use it for doing the project. We can learn from you all about the things that we have been used to fight back with the mosquito-borne disease around here in our kingdom, especially the common mosquito-borne disease, such as dengue and Zika, chikungunya, but mostly about the dengue. Because nowadays I heard about one of our boss here trying to use worm back here from the barrel mosquito, but I didn't support it. That's why I really love to do the proceeding research, just to get together with the communities, try to train them with only the physical, easy ones, not easy
Easy
the
ones.
chemo. Yeah, because of we know for sure the AMR, the resistance of mosquito from chemicals.
Mhm.
We have to do to our common control now, like into a residual spray. I
Mhm.
need to to monitor our people like they doing our spraying. Despite from not using the work back here, we are too far from using work back here now. We need to use the insecticide, indoor residual spray and outdoor residual spray, and move on to another thing like working with the community, like doing the physical prevention of mosquitoes, despite from work back here. But maybe we can use it, but later after my time on work, they can use it, but not now. That's why I love to hear from you guys about operational research, and I think and I believe my boss can join us too, and not to support work packet using of work packet. We need to use a common one now to be using despite from work packet. And thanks a lot, Sebastian and Adam, for helping. And hope we are the same with the Google and Charlie. We need to have some extra coming to PNC training. Okay, thanks a lot.
Great, Sciola. I think so. It sounds like there's interest, and perhaps in Tonga, it's about just identifying which communities are the ones that have, the people, which groups in society are most resistant to these chemical treatments. So whereabouts in Tongatapu or other parts of the country is there most concern or resistance to the idea of indoor residual spraying, so that the survey can really get to the heart of the problems that you're facing with communication, possibly. I saw that Cook Islands and Vanuatu and Samoa also joined.
Yep, and Fiji. Yeah, we've
Fiji's
got a nice spread of representatives from programs who all have really good experience working in their communities with dengue. And so it was a good point that Ciala raised about Wolbachia. New technology is another thing potentially ask the community their attitude to. But, you know, even if you have a technology like Wolbachia, you're still going to have to spray for the other vectors at some point, probably. So it's still useful to know what the attitudes or what the problems are, as Adam was saying.
Yeah.
And I know, yeah, some of you on the call probably have your own questions that you'd like to know from the community. Hi, Max. Great. Thanks for joining us. I'd be interested to hear if anyone has other questions, just off the top of your head that you think would be important for us to consider. Obviously, we'll discuss it further after this call, but did anyone want to make any other comments or ask any more questions about how we might move forward with this or being involved?
No.
Ciala's happy.
Yeah, very good, very good.
Okay, the question on the chat there from Christy. Hi, Christy. Thanks for joining us. I'll read it out. Could PacMOSSI support with testing of the presence of Wolbachia, as we have implemented, but we still have outbreaks of dengue in some areas where we distributed Wolbachia? Ooh, great question, Christy. So we could potentially help. It's not the specific topic of this operational research, but I'm glad you asked that question because it raises another important point we should mention on the call, and that's if you have additional questions, like the one Christy's asked, that you would like to answer for your programs, like Christy's asking a question that I think Fiji have also asked, and are still asking. We have Wolbachia, but is it working? And why do we still have dengue? So that's a different question to what we're asking in this research, but it's related, very relevant question. If you have a question like that, that's not exactly what we're asking here, we could consider ways that we could build that into what we're doing here in terms of community attitudes. But if you need to do a separate project just to look at that, for example, you can always propose that to us and we could possibly organise a separate project to do that. So if that's the case, it might be good just to drop us an email to the PacMOSSI email or to me or Tessa or whoever, and let's have a chat about it. That goes for everyone else as well. If you're thinking, I have other questions, not the question that we're talking about today, we'd love to hear that. And there will be other opportunities in future to work on different topics. I hope that helps, Christy. Did you want to comment any further on that?
It might be worth, Christy, talking with Rama also, because I know that Fiji's got similar questions, and I know that you're online, Rama, but you've been talking with Katie Anders about trying to answer some of those questions from an epidemiology perspective. So it might be an opportunity there for a joint project around seeing how the uptake of Wolbachia has affected dengue risks.
Yeah, great. Did you want to comment, anyone from Fiji, on that, or not really at this time? I know it's a bit off topic, but if you wanted to say anything about your views. No.
Thank you.
Yes.
I hope you all can hear me.
Mhm.
Yeah, for the Wolbachia, I know there's a lot of question about Wolbachia high effectivity. So Wolbachia program is supporting Fiji for doing the analysis. We are yet to do the field collection because of the weather conditions, and during this time of the year, we don't have that abundance of Aedes aegypti on the project site. And Fiji is another unique country where we have more than one principal vector. So we have Albopictus, Polynensis, Pseudo, and so forth. So we have seen that it has made an impact. So I'll just cut it short. But we're still trying to see whether they still, what's the frequency of Wolbachia and Aedes aegypti within the project site? That's a big question, whether it has self-sustained or not, before we commit further to roll out throughout the nation. That's the thing. If it is effective, because it comes with a price, and that's one thing. And so a lot of people, a lot of clinicians, they are asking how effective it is. Even the minister and our permanent secretaries and other hierarchies, they are asking on it. But later on this year, we should have a better information to provide those to the general public and to all the people, whether how effective and self-sustainable or not or what. That's one thing. Regarding the operational research, it would be great to know what would be the sample size some of the countries would be interested in. Then we can say, okay, how we will carry out that project, operational research. Looking at the multi-racial country Fiji is, so the design of the questionnaire, the traditional values and things like that. The location where they stay, urban, peri-urban, squatter, informal, those things needs to be factored in. I think it will be very interesting to see how best and how quickly we can get the ethical approval, because we will be dealing with human information. So that is something that is a bit tricky. It might take a couple of months. See? So that's something that is a big question for Fiji.
Yes.
I'm not sure of other countries. And
Absolutely.
just to let everyone know, we have a huge donation worth of $2 million from China on the new control mechanisms, the light traps, the sticky traps, and those things, bed nets. So that $2 million worth of funding assistance from China, it's coming from government to government, and the government has priority. So that is another priority for our unit with the limited number of staff to have those projects implemented. And since it will be phased out for 2 years, we will be heavily committed in that way as well. So that is something that, just like Wolbachia, if you are using light trap, how effective it is, how people reacts to that because of the power consumption and things, putting together with the climate change, the El Nino coming in, how people will be factoring all those things. We know that in Fiji, people have a lot of knowledge and information about how dengue is transmitted, how mosquitoes breed, but it would be more important to know why we're still having dengue and why people are not reacting, even though they know where mosquitoes are breeding. Where is the gap that is causing the mosquito breeding, and who is probably that's something that would be, because we have quarterly cleanup campaigns and things. And I mean, sorry, I'm not trying to be offensive to anyone, but looking at the Pacific Island countries' mindsets, where we are just asking whatever anything is coming, we accept, we want it, we keep wanting it, rather than actually using that to sustain a program. I think that's where the gap is, and how we can really make an impact on the behavioral change of the people. Thank you. That's all. Anything else, colleague? Thank you.
Thanks, Rama. Always love what you have to say. From what you just said, I think the two things that stood out to me. One was you talked about, getting the right question. What is the question that this operational research will answer? And I think that's for those that want to be involved. That'll be the first phase of the co-design, is really understanding, what is it that the group want to get out of this household survey or whatever the method is that's chosen. So that's critical. And then second, building on from that, what is the method and what's the sample size and those questions? And they may differ by country, and that's okay. But just being very clear that we need to align the questions we ask with the method. And then thirdly, you talked about feasibility. And I think Sebastian's got a few more slides before we finish about what's the next steps for countries to express interest in this. And definitely feasibility is a major consideration.
So I
Thanks,
think,
Rama.
yeah, thank you very much for all the comments. Yeah, totally agree with what I just mentioned now regarding the feasibility. So the sample size that you mentioned is probably something that we need to co-design according to the ability that you have for implementation. So it's something that will be discussed, and now we can share here how it's going to be the next steps. So we have, you can see my screen now. Here is the presentation here.
Yes, we can see. Now we can see your desktop. Yep, that's right.
Oh, sorry, just
I'm going to stop talking.
no, just to show directly here what we have regarding the EOI. So first, I will show you this. So you can see a Word document, right?
Yes.
Yes, perfect. So this is the expression of interested that we want to disseminate across the countries who are interested in participate. So they have some critical information about the project or about what we discussed during this presentation, what we need from the participant countries to do. So we here put some examples of how it's going to be the size of the fieldwork team, how it's going to be the size of the household that would be apply the questionnaire if we decide to do that, or if we decide to do focus group or interviews. We can all this co-design with you and put in place how is going to be the best approach to do this, and of course to calculate the sample size and then calculate how it's going to be the best team to do that in place. So the EOI is basically the applicant details to put who is going to apply in terms of representativity of the country, the organization, the position, the context. And we have two critical parts that are related to the project suitability. So this is interesting for you. So you are using chemical mosquito control method. So if you are planning to understand this third component that you discussed during the meeting regarding to the human component, so how is suitable for you to implement this potential operational research idea. So describe here how which control measure you have. How is the community acceptance that you have in place right now? So you already know if the community have some concerns, if you already have some community communication or community engagement activities in place. So this is important to the suitability of the project. And a second part that is related to the feasibility. So if you are able to conduct the households contact interview, the community interviews, and of course, if all the delivery of the project regarding to the ethical application, to the implementation, if you have the support to do all this in the fields regarding to transport, to the people who is going to implement the questionnaire. So it's basically this that you're going to fill is just 2 pages. And the idea is to have this flow regarding to the next steps. So one is related to the application deadline. So submit the EY by September 30. So we are talking about 1 month since now to complete the EOI, this 2 pages that if you are working with someone to trying to fill up the most detailed possible to know if the project is going to be so feasible to do it. Then between October and December, construct this project with all the protocol, with all the details, to calculate the sample size, to understand the research question, to put the method properly according to the research questions, and starting all the documentation that we need to have in place for the ethical approval. So this is going to be at the end of this year. And as you mentioned during the meeting as well, the ethical could be more fast, or can take a couple of months to be approved. So we are planning to start the data collection in March of the next year. So probably the next year, if we have everything in place, we have the ethical approval, we will be able to perform the surveys and the interviews according to what we're gonna decide. And at the end of the next year, Q3 and 4 of the 2027, analyze the data and report and construct the dissemination for the countries according to what we get. So that will be the next steps regarding the EOI. So I'm gonna open again and come back to you, and Adam, if you wanted to complement something related to the application process, please feel free to complement it.
Thanks, Sebastian. And Cial has a question in the chat, and the question is just around, how to apply, or what's the next steps. So I think after this meeting, is this right, Sebastian? After this meeting, we'll send an email out with a simple, 2 or 3 question EOI, expression of interest form, just asking, who is the applicant, how ready what the question that the country wants to respond.
Will do.
So can you put yourself on mute, whoever's on their iPhone?
Oh, that's from your thing. Yeah.
Thank you. Yeah, so expression of interest form will go out in the next day or so for countries that are keen to be involved or be considered, to just outline some basic information, and from there that co-design process will follow. And I think, Sebastian, your timeline was reasonably clear. The idea of spending the rest of this year designing the work, and then ideally getting ethics at the end of the year and implementing early next year.
Yeah, exactly. So we're gonna send the email with the EOI to the countries to start to have a look of what they need to answer. But basically, it's contact information, the suitability for you, and the feasibility to implement what we are proposing now. And then when we receive all this EOI, we're gonna have a meeting of the PacMOSSI team with the PNG AMER to decide which country are more suitable to do this. So we're gonna select some countries from there. We're gonna notify you, and then we're gonna start all the co-design process.
Sebastian, Charlie from the Kokana. I got a question, a comment.
Sure, Charlie.
Thank you for that previous presentation. Looks like most of this survey will be concentrating on the outdoor residue spraying. But can you define all these words, including this new word, not a new word, it's familiarized with us? 1, mass spraying. 2, perifocal spraying. 3, proc spraying, and plus the IO and the indoor residue spraying and the outdoor residue spraying. These are the activities normally carried out here in the Cook Islands, apart from the lower side of things. But because we want to clarify so that people will understand, when we promote this outdoor residue spraying, all these words pop up, like the mass spraying, which is the mass spraying around the island and the country as a whole, and also the perifocal, concentrating around the dengue cases, and plus at least up to 200 meters, There's a perifocal. That's our definition we use, and plus the normal outdoor and indoor. Would that be possible?
No, I think the definition that you're using is dependent of the context of each country. So each country is going to have different approach. So we need to customize the questionnaire. So if you are talking about the knowledge, the attitudes and practice, it's going to depend of what you want to focus. So if in the Cook Island you have this strategy in place, of course, the questionnaire need to focus on this strategy. But probably the reality of Tonga or Fiji or other countries want to focus on another strategy. So that's the idea of the co-design in doing customized for each country, because it's going to depend of the reality that you have in place. And if you want to check specifically one strategy compared to other one, we can put that in place in the interviews and the questions on the questionnaire as well, Charlie.
Oh, that's cool. And according to the locations, like I mentioned before, our islands is distributed right across 2.1 million square kilometers of ocean. And I'm thinking if it's possible, we can use those 11 stations throughout the countries so that we can get our numbers for each island, and including mainland Rarotonga. And I am forecasting that once these things approve, there will be resources in terms of funding will be with the package. Is that correct, Sebastian?
Now, I think we discussed about as we mentioned the sample size. I think it's depend of what community, what village, or what region are you planning to target with this approach. So, for example, if you want to target many regions, you need to check the feasibility to do that, and according to that, we can calculate the sample size for each region. So I think it's something that we need to work together according to your interesting, but it's something that we can work for sure and understand better which region and which different approach you have in place in one of the region that you want to work. Yeah. Adam, sorry.
Yeah, that's okay.
In
Charlie,
terms of resource funding, is that worked out?
Yeah, Charlie, specific to your question about resourcing, PacMOSSI have funds to support the implementation of whatever the design that we end up all agreeing on is. Of course, those resources are there's not millions and millions of dollars. So that needs to be factored into the scale of the project. And, I think that's part of the co-design process. I mean, the questions and the scope of the work kind of need to match what funds are available. But definitely, in capital cities where spraying is more likely is likely feasible, and then some outlying islands potentially too. Depends on who's doing it, what resources are required. Yeah.
Okay.
But PacMOSSI will support you is the point.
Yeah, it comes into sense then the last outbreak we have only 3 islands, so we will concentrate around that 4 islands. Rarotonga, Aitutaki, Mauke, Atu, and Mangai, those 3 islands. There's nothing up north, so we will concentrate around these 4 islands. Thank you, Adam. Thank you.
That's okay. I think, Charlie, it's probably important that it's because it's about behavior and in relation to chemical treatments. Obviously those islands would need to be doing some sort of, or have some plans to do some sort of chemical response. So that might help countries narrow down the scope somewhat.
Okay.
Yeah. Awesome. So I think the next step for us then is to send out this questionnaire. Are people happy doing it online, or do they want to do a paper-based kind of response for the EOI? What is easier?
Then online first before we would send the Cook Islands one online.
Okay, but it's very simple. I think we'll keep it as simple as possible. Huh? And Phil, of course, anyone who has any questions or would like assistance with filling out the EOI can always reach out to Sebastian or Amanda or myself or Melanie too. We're very happy to help. It's not it's not meant to be a test or a barrier to being involved by any means.
And we'll send that after this call in the next day or two, won't we, Adam?
See.
Yeah, pretty soon. So look out in your inboxes for that. Fill out the form and then we will get back to you. And I'd just like to, as a final note, just encourage people to also think about, we'll discuss this further, but whether or not you think you have capacity within your teams in the ministry to actually go and do this sort of work, like house-to-house surveys, or whether you would like to engage a local partner to assist, and the ministry kind of gives guidance but doesn't have to be the one actually doing it. If people can have a think about that in terms of what's practical, there's probably an opportunity to mention that in your